Hi, my name is Misty Richmond. I'm a PhD student here at the College of Nursing at the University of Cincinnati. I'm a Jonas Scholar, and I'm also the GNSA Liaison here at the College of Nursing. It's my pleasure to introduce to you Donna Martsolf, who's the Dean of Research here at the College of Nursing, who has agreed to be interviewed as part of the Leadership Project for Nurses Week. Just introducing yourself, sharing what your title and role are here at the University of Cincinnati.
Yes. Hi, I'm Donna Martsolf. I'm the Associate Dean for Research and Translation at the University of Cincinnati College of Nursing.
Can you tell a little bit, if you wouldn't mind, about your educational background, your research background, whatever led you to your position here?
To the position where I am right now. Yes, I actually did the kind of the standard way of going from high school to being a PhD prepared nurse, at least at the time. I graduated from high school in the late 60s and went on to the University of Michigan, where I received my Bachelor's of Science in Nursing. I was not intending to be a nurse, but when I got there and realized that psychology in the 60s was mostly about seeing rats run around a maze, I lost some of my interest in psychology and really figured out that nursing would be a great place to connect with people, and also later on I realized that really what my passion was in mental health nursing. So got my undergraduate degree from the University of Michigan and then went on to Philadelphia, where I worked at Thomas Jefferson University Hospital and became the title at the time was head nurse in the inpatient psychiatric unit, and realized that I loved psych. I did med surg for about 3 or 4 months after I got out of school and realized this was not my passion at all, but mental health really was, and I loved inpatient psychiatry. It was fabulous. But while I was working as a staff nurse and then as a head nurse, we had these clinical nurse specialists on our unit. We had 2 of them, and I couldn't figure out how they got to be so smart. They were just brilliant. And so then I went to Penn. At the time in the mid-70s, early to mid-70s, NIMH was trying to get more advanced education for nurses who wanted to work in mental health. And so they had these stipends and full tuition. And so I took advantage of a stipend and tuition to go to University of Pennsylvania and got my master's in psych mental health in the mid-70s. And then that's when I realized how these folks got to be so smart. They went and got a master's degree. So from there, I worked in consultation liaison at Jefferson on the psych team, and we made rounds in the hospital. So I was assigned the responsibility for units like the NICU and the ICU and orthopedics and one of the oncology units, where I would work with the nurses to help them meet some of the patient and family needs. And then I also made rounds with the psychiatrists when they were called in to do psych consults. Then I would work with the nurses to kind of translate how to use what the psychiatrists were saying in direct patient care on these med-surg units. That was a great job. I then went to a community hospital in rural Pennsylvania, where they had 2 inpatient psych units, and they were trying to really advance the level of the nursing practice at on those units, and I went there and worked there for 3 years, and then did some teaching part-time, and finally decided that what I really wanted to do was to get my PhD. And I love clinical practice. I did outpatient psychotherapy with a psychologist, seeing primarily depressed women, and in groups and individual therapy. I did that for 7 years, but wanted to go back and get my PhD, and went to the University of Pittsburgh. And when I was being interviewed, the interviewer kept asking me about my research focus, and I honestly, I had no clue really that this was going to be a research degree. I don't know how it eluded me, but this was in the mid-'80s, and so there wasn't a DMP, and so I quickly came up with this area of research I wanted to do, and I was admitted to the University of Pittsburgh. Well, after my first class, which was History and Philosophy of Science, which we had to take in the HPS department at University of Pittsburgh, I figured out I loved theory, I loved history and philosophy of science, I loved research. And so I was really grateful to be going through that program. And at the time, I kind of identified I was also doing a lot of work overseas in Haiti. And it was mostly clinical practice and doing mobile medical clinics. But I often, when I would go to Haiti, I would, as soon as I would get off the plane, there were all these American expatriates there who were just really having some struggles emotionally, being away from home. Often they were there for many years. And so I would spend a lot of time doing really at least walking wounded kinds of interventions, psych interventions with these folks. And so my dissertation did focus on the whole idea of cross-cultural migration and what it does to physical and mental health. So that then led me, though, I did, after I finished my PhD, I then worked for a year as the project director on a funded grant at the University of Pittsburgh, and then a tenure track came open, and I went at Kent State University, and I went there on the tenure line, and again found I loved teaching, but I also loved research, and I began my real research career there, and worked with a colleague, and the two of us together worked around issues around interpersonal violence, childhood maltreatment, physical and mental health of adults who have experienced childhood maltreatment, which fit in with some of the dissertation work I'd done. And then we also did some dating violence work and some a big study around sexual violence. So that's kind of what led me to the point of when the dean here at University of Cincinnati asked me if I wanted to come and be the associate dean for research. That's kind of the pathway that got me there.
Wow, thank you very much for that. Could you talk a little bit about your research in terms of some of the gaps in knowledge and the significance, perhaps? Mm-hmm. I don't know if you want to do that in a general sense for psych or whatever.
Well, I think, you almost have to be specific, because when you're looking at gaps, you have to think about what are the gaps in knowledge. And so, yes, when Dr. Claire Drucker and I were working together around the whole issue of sexual violence, and one of the gaps that she had found in her work and that we then examined together was the whole idea of not really knowing how people heal. We know that they do heal after sexual violence, but we needed to have a sense of what's the process by which they heal. So we conducted a grounded theory study that looked at what's the process by which men and women manage after having experienced sexual violence. And we did both interviews with individuals who had experienced sexual violence at any point in their lifespan, and we also did a large qualitative metasynthesis around all the qualitative findings that had to do with sexual violence. And we were able to determine, both with our interviews and with the qualitative metasynthesis, some of the processes by which people do heal, along with learning a lot about especially the effects of sexual violence on men, because we did have a sample that was about half men. Wow. And that really filled a gap that not too many people have addressed, the issue of men and how they recover from sexual violence. So that, and then with teen dating violence, we were funded by the CDC on an R01 where we looked at we developed a theoretical framework around to try to describe and explain and predict how teens get into these dating violence relationships, what happens while they're in them, and then how they get out. And the reason that was important was because there are several empirically tested dating violence prevention programs, but there really wasn't a good theoretical basis to understand how do the kids even get involved in these things and what actually goes on while they're in them, and then how do they get out. So that we were able to determine that through using a grounded theory approach to that study as well.
Wow, very interesting stuff. I'm learning a lot about what you've done too. Can we talk a little bit now perhaps about your leadership and your interests there and what you feel like you bring in terms of nursing leadership?
Sure. Probably while I am doing a lot of leading here as an associate dean for research, probably more of my leadership skills were used in my work in Haiti. And I worked with a group of people, educators from across the country at University of Michigan and at Barry and a number of different universities to work with Haitian leaders to develop a baccalaureate program of nursing in Haiti. And I, for a number of years, was chair of the governing board of that organization. And we now have a full-fledged baccalaureate program now we have 19 of our graduates who are, we had colleagues from New York who then brought a master's degree there, and they're offering that on the grounds of our school. And so we have 19 of our graduates who are in our master's program. They'll be the first MSNs.
Oh, wow.
And so that project required a lot of leadership skills in that you're trying to bridge two cultures and two different ways of understanding how things should be. We had grants from USAID, from the branch of USAID that's called OSHA, or ASHA, American Schools and Hospitals Abroad. And so to work with the federal government, there are several foundations who were a part of this, Haiti Nursing Foundation and Medical Benevolence Foundation, to work with those three organizations to then try to take an American board members and Haitian board members of both the school and the foundation to get all these people to work together required a fair amount of leadership. And then, of course, we had the earthquake that hit in the middle of that, and I was the chair of the governing board at that time. So, of course, we had many, many, many volunteers from many different parts of the country, and to coordinate them really did take some leadership.
Wow. I would say. What do you feel, bringing that back here to your role here at the University of Cincinnati, how do you feel that nursing and healthcare are better because of your leadership experience?
Well, yeah, primarily my focus is on what nursing can do to make a difference in the lives of patients, in this healthcare system, and certainly at the university level. So I just feel really strongly that as nurses, we need to be leading healthcare, and especially the change, because we are so, in our education, we really are educated to think holistically. And if we take our community health courses seriously, which I was really fortunate when I went to Michigan to have a great undergraduate community health course, and if we take those principles seriously, we really do have that holistic systems understanding that allows us to lead. And because we can, if we take those principles and we use them well, we should be able to bring the patient, their families, all the different disciplines together around furthering the health for a given individual patient, but also really advancing health for populations of people as well.
Do you feel that there's a connection between the research you've done in the past and healthcare policy?
Yeah, that's probably the next step in our, once you start addressing gaps, and then you have to figure out then how's that gap going to be advanced. So I would say that that's the next step that we're going to be needing to focus on is intervention, and then how those interventions are going to affect policy around definitely finance, for example, for both teen dating violence and sexual violence prevention. Yes, that's our next big step.
Well, you make me wonder about counseling for people recovering. And such.
We did. Actually, we wrote an article about that when we did our metasynthesis of sexual, how people perceive their any helping professionals. One of the things that we did see in the literature is that often we're not doing, sexual violence in particular goes unrecognized, even though someone has seen multiple healthcare professionals with these vague somatic complaints. The sexual violence part isn't picked up. And so we did actually write an article about exactly how should you assess someone to determine whether or not they have experienced sexual violence, and how then do you get them the appropriate services.
Thank you. It's, do you think that your science impacts on healthcare systems?
I do, in that sense. One of the places that we really have tried to go is in looking at how do people who work in a system have organize their system in such a way that they can have the time and the expertise necessary to do the appropriate assessment. And when you have a list of 100 things that you need to do, what we don't want to have happen is that it's just another check-off thing. Have you experienced sexual violence? Do you feel safe at home? Check, check,
yes
check.
Or no, yeah.
And then hoping that no one says yes, because we don't really have the time to deal with it anyway. So that's kind of where we've been focusing on, is trying to figure out if we really can get these kinds of interventions. The same thing with working now on young people, college-age students who have experienced dating violence, and trying to get an intervention going. But we're going to have to be working with universities and colleges to partner with us to get the intervention, to have it made available to students. So, and we've done a lot of work in the community too around dating violence prevention, but it's very challenging work, because of course it always has to do with what is being funded and what time do people have to really address the issues that you find to be so very important. But there are a number of them, and that different constituents are going to argue are more important. So yeah, it's an area that we really are continuing to work on.
It's an important area,
Mm-hmm.
I would say. Is there anything else about your research that you'd like to share?
I think one of the things that was most fun was when I was able to take the same research questions and adapt them and move them to Haiti. I was a Fulbright scholar there, and part of what I did was to examine histories of childhood maltreatment in adults, and then compare it to their physical and mental health symptoms, and saw that really there's very high levels of maltreatment, not because of, some of it could be because of lack of resources, but setting those issues aside, issues around sexual violence, for example, were pretty, the rates in the study were pretty high, and so it was interesting to be able to do that study in Haiti and make some comparisons to what I've done here in the U.S. as well,
yeah.
and look at examine the cultural differences. Mm-hmm. Yeah.
Very interesting.
Mm-hmm.
I want to switch to leadership.
Mm-hmm.
When I interviewed Dean Glazer last week, she told me about, I don't think conference is the right word. There's a meeting this week on campus that I believe you're,
yes. Mm-hmm.
and if you could, and I'm sorry that I don't
Yeah.
have more details, but
Yeah.
if you could share what that's about and what...
Right. What we're doing this week, the University of Cincinnati, through our Vice President for Research, we've been examining the future of funded research at the University of Cincinnati. And our Dr. Bill Ball, who is our VP for Research, has convened the Associate Deans for Research, other key stakeholders at the university for about the last year and a half in a variety of venues to develop a white paper around the future of funded research. And so at the College of Nursing, what I decided we needed to do, because our vision is that we will creatively leverage technology to lead the transformation of healthcare in partnership, informed by the people whom we serve. And so the leading the transformation of healthcare in partnership is the part that we've carved out for this week, where we issued an invitation to all researchers across the entire campus, both the Academic Health Center and the 4 colleges there, and all of the other colleges, arts and sciences, engineering, our education, criminal justice, and human services. So we invited all researchers, and we have nearly 100 people, and
wow.
We're going to be sitting down. We're going to be hearing from our VP for research here at the university. We're going to be hearing from Dr. Marion Broom. We wanted a nurse leader to do the keynote. We're going to be having panelists of researchers from the university sharing how we can partner together to form key partnerships to respond to some of these areas of health research where we really can't get at the knowledge that's needed without working together across disciplines and across colleges. So they'll all be coming to the College of Nursing. We'll be hearing from the various speakers, and then in the afternoon we're dividing in discussion groups where we will take the future funded research at UC document, and we're going to be turning that into a series of next steps that we will then write up as a list of recommendations to our VP for research for where the university should go next. So yeah, it's been great to lead that process and be ready and help. We've got some students who are going to help with things like taking notes so that we have good data to put into our list of recommendations paper, and involving some of our faculty. But it's amazing to me that we have every college on campus represented, and a number of deans are going to be coming, and we're looking forward to it. It'll be a great day, I think.
That sounds like an excellent event. Can you talk a little bit about the importance of nursing in terms of nurses being the leaders for events such as that, as well as you mentioned being the keynote speaker?
Yes. Well, I do think that the uniqueness of nursing, if we really look at how's nursing defined as a discipline, what are the things that we really we know have to be part of all of our curricula, because these are the basic fundamental principles of our discipline. We do think about the fact that any nurse who has been well educated knows that nursing does not stand alone ever. We are always working in partnership with all the other disciplines, because central to what we do is the patient or the community. And anything that needs to occur to help our patients and our communities be more healthy is where nursing is. And we always are trying to pull in the right resources. And so I think the College of Nursing is ideally positioned to pull all of the researchers from across all the colleges, because we, from the very time we became nurses, understand that unless we all work together, we're not going to be able to solve the health-related problems of individual patients, of communities, and in this case, to develop the programs of research that are going to answer the questions that need to be answered at this point in time. So I think we have to lead. I think we're the logical people, and so we're leading. And we were not asked to do this conference or this retreat day. We came up with the retreat, but it was with careful listening. I attend all these meetings that the VP for Research has in my role as Associate Dean, and I'm listening to where he's trying to go, and it became obvious that the next step, if the College of Nursing opened it up and said, we're hosting this, and we're going to lay out the day, and we're going to show you where nursing fits, but we're also going to provide an environment in which everybody fits. And the panelists, I was very careful to make sure that I got a representative from each of the colleges. I couldn't make the panel so huge as to have 10 different, but of the 5 on the panel, everyone represents a different college. So we tried to do, and all colleges are represented in one way or another across the day. Not just with participants, but in leadership roles as well.
Excellent. Wow. Is there anything else you'd like to share in terms of your leadership or your scholarship?
I think at this point in my career, the only other thing is that it's wonderful to be at a point where those of us nurses who were educated in the 60s and 70s, it's time for us to really be thinking about our legacy. And I've seen this in so many venues where I see women who were educated around the time that I was, maybe a little earlier, who really are now focused on the legacy, and how can we as nurse leaders bring forward the next generation of nursing leaders so that our discipline becomes even more critical to the mission of healthcare in this country, and that we really have the next generation of leaders who can make that happen.
What advice would you offer to the next generation of nursing leaders?
I think really one of the things I've noticed with a lot of the younger folks as they're coming up is this whole notion of being spread way too thin. I see it in my students. I see it in the community among nurses, and I would really advise our new, young, up-and-coming leaders to really focus themselves, get themselves focused, and don't try to do all aspects of life at one point in your life, because you do have a length of life. And at certain points, I really focused, for example, on raising my children, and parts of my career were a little bit different than they are now. At other points in my life, I focused on getting my education, but I wasn't trying to buy a house and a car and everything else at the same time that I was getting my education. And I do think that if there's a certain amount of focus, in the end, you get where you want to go. But I see so many of my young colleagues just trying to do so much of their life right this minute, and then wondering why they don't have the time to do the reading that they need to really learn the things that they need to learn to be a leader. Somehow they want things to come much more quickly and much more painlessly, and yet to really be a nurse leader requires education, and education is painful. And growth is painful. And I would advise them to go through the pain and not try to avoid it, to really learn everything that you need to learn in a deep way, and not try to just skim through it. So that would be my advice.
Thank you.